would drive a seasoned emergency room nurse to request a transfer to a completely different department after just one night. In today's story, you'll discover what happened during my shift at Sacred Heart Emergency Department that changed everything I thought I understood about life, death, and the thin line that separates them. But before we dive in, make sure to subscribe to help us reach our next milestone, and drop a comment letting me know where you're watching from. Now, settle in, because what you're about to hear will challenge everything you believe about what's possible in modern medicine. There are moments in your career when you realize that all your training, all your experience, everything you thought you knew about your profession was just scratching the surface of something far more complex and unsettling. I carried one such moment with me for over a year before I found the courage to share this story. My name is Sarah Chen, and I spent 8 years as a registered nurse in emergency medicine before that night in September changed the trajectory of my entire career. Prior to that evening, I had always prided myself on my clinical judgment, my ability to remain composed during the most chaotic situations, and my unwavering commitment to patient care. I had witnessed countless traumas, held families together during their darkest hours, and seen medical miracles that defied explanation. I thought I had encountered every possible scenario an emergency department could present. I was completely wrong. The events I'm about to describe took place during what should have been a routine night shift at Sacred Heart Medical Center, a Level 1 trauma facility serving the greater metropolitan area. I had been working in emergency medicine for 8 years and had recently been promoted to charge nurse, a position that required overseeing the entire department during my shifts. What I didn't anticipate was that this particular night would test every skill I had developed and force me to confront possibilities that medical textbooks never prepared me for. Sacred Heart Emergency Department was a state-of-the-art facility with 42 treatment beds, advanced diagnostic equipment, and a trauma bay capable of handling the most critical cases. Our department saw everything from minor injuries to life-threatening emergencies, and our team had developed a reputation for exceptional patient outcomes even in the most challenging circumstances. We were accustomed to high-pressure situations and complex medical cases that required immediate intervention and precise coordination. The night of September 21st began like countless others I had worked over the years. I arrived at 6:30 for the 7 o'clock shift change, reviewed the patient census with the day charge nurse, and prepared for what appeared to be a manageable evening. Our patient load was moderate, with 28 patients currently in various stages of treatment, and the incoming staff seemed well rested and ready for the night ahead. Dr. Michael Torres was the attending physician that evening, a veteran emergency medicine doctor with 15 years of experience at Sacred Heart. I had worked with Dr. Torres on hundreds of cases, and his clinical expertise and calm demeanor made him one of the most respected physicians in our department. Also on duty were Dr. Amanda Rodriguez, a second-year emergency medicine resident, Lisa Park, a respiratory therapist with 12 years of experience, and Marcus Thompson, a paramedic who frequently worked in our department during busy shifts. The first few hours of the night proceeded normally, with the usual mix of patients presenting various conditions, ranging from chest pain and abdominal complaints to minor trauma cases. Our team worked efficiently, moving patients through triage, diagnosis, and treatment with the practiced coordination that comes from years of working together. It wasn't until nearly 10 o'clock that we received the call that would transform an ordinary night into something that still haunts my dreams. The paramedic radio crackled to life with a Priority 1 call. Sacred Heart Emergency. This is Medic 12 with a priority transport. We have a 26-year-old male, victim of a climbing accident at Devil's Canyon. Patient fell approximately 60 feet onto rocky terrain. Multiple trauma with suspected head injury, chest trauma, and possible internal bleeding. Patient was unconscious at scene but regained consciousness during transport. ETA 4 minutes. I immediately began preparing Trauma Bay 1, while Dr. Torres assembled the trauma team. Devil's Canyon was notorious among local emergency responders as a dangerous climbing area where serious accidents occurred regularly. The mechanism of injury described by the paramedics suggested we were about to receive a patient with life-threatening injuries requiring immediate surgical intervention. Sarah, let's get blood bank on standby for 6 units of O-negative and notify surgery that we may need an emergency OR, Dr. Torres instructed as we prepared for the patient's arrival. Lisa, make sure we have airway management ready in case his respiratory status deteriorates. The ambulance arrived precisely 4 minutes after the radio call, and the paramedics quickly transferred their patient into Trauma Bay 1. What struck me immediately was not the extent of his injuries, though they were certainly severe, but rather the patient's level of consciousness and awareness despite the trauma he had sustained. The patient, whose name was David Mitchell, according to his driver's license, was awake, alert, and speaking coherently despite having fallen 60 feet onto solid rock just 2 hours earlier. His vital signs were stable, though he showed obvious signs of significant trauma, including multiple lacerations, suspected rib fractures, and what appeared to be a serious head injury based on the mechanism of his fall. "How are you feeling, David?" I asked as we began our primary assessment. "I feel strange," he replied, his voice clear and steady despite his injuries. "I remember falling, but everything after that seems different somehow. I can see things more clearly now than I could before the accident." This response was unusual for someone who had sustained a significant head injury, as most patients with traumatic brain injuries experience confusion, disorientation, or altered mental status. David appeared more lucid and aware than many patients who arrive in our emergency department with minor complaints. Dr. Torres began his examination while I documented David's vital signs and injury patterns. His blood pressure was slightly elevated but stable. His heart rate was within normal limits, and his oxygen saturation was excellent despite suspected chest trauma. Most remarkably, his neurological examination was completely normal with no signs of the cognitive impairment typically associated with significant head injuries. "David, can you tell me what happened during your fall?" Dr. Torres asked as he assessed David's pupils and tested his reflexes. "I was climbing the North Face route when my anchor failed," David explained with remarkable clarity. "I fell backward and remember hitting the rocks, but then something extraordinary happened. During the fall, I experienced something I can't really describe. It was like I could see everything that was happening from outside my body, and I understood things about the accident and my injuries that I shouldn't have been able to know." Dr. Torres and I exchanged glances. Patients sometimes report unusual experiences following trauma, often related to the stress response or effects of injury on brain function. But David's description was unusually detailed and coherent for someone who had just experienced such severe trauma. As we continued our assessment, David began describing aspects of his accident and rescue that seemed impossible for him to have observed from his position. He provided accurate details about the rescue team's approach, described conversations that had taken place while he was supposedly unconscious, and even mentioned specific equipment the paramedics had used during his treatment. "David, you were unconscious when the rescue team arrived," the paramedic who had transported him confirmed. "You didn't regain consciousness until we were halfway to the hospital." "I know that's what it looked like," David replied calmly, "but I was watching everything that happened. I could see the rescue team discussing the best approach to reach me. I saw them debate whether to call for a helicopter. I watched them check my vital signs and decide I was stable enough for ground transport." The paramedic stared at David with obvious confusion. Every detail David had described was completely accurate, including conversations that had taken place while he was clinically unconscious and positioned in a way that would have made observation impossible even if he had been awake. Dr. Torres ordered a complete trauma workup, including CT scans of David's head, chest, and abdomen, along with comprehensive blood work and X-rays of his extremities. While we waited for the imaging results, David continued to demonstrate an awareness that defied medical explanation. "Dr. Torres, you're going to find a small subdural hematoma on the left side of my brain," David said matter-of-factly as we prepared to transport him to radiology. "There's also a pneumothorax on my right side that's going to require a chest tube, and I have internal bleeding from a grade 2 liver laceration." I felt a chill run down my spine. David was describing specific injuries using precise medical terminology that most patients wouldn't know, predicting findings that we hadn't yet discovered through our clinical examination. "David, how do you know these medical terms?" I asked, reviewing his intake paperwork. "Your emergency contact form lists your occupation as a software engineer." "I have no medical background," David replied. "I don't understand how I know these things. It's like the information is just available to me now, as if the accident opened some kind of door in my consciousness." 30 minutes later, the radiology results confirmed every prediction David had made. The CT scan revealed a small subdural hematoma exactly where he had indicated. Chest X-rays showed a pneumothorax requiring immediate decompression, and the abdominal scan demonstrated a grade 2 liver laceration with active bleeding. Dr. Torres stood staring at the computer screen displaying David's imaging results, his expression a mixture of professional concern and complete bewilderment. "Sarah, in 15 years of emergency medicine, I've never encountered anything like this. His predictions were not just accurate, they were precise down to the specific anatomical locations and injury classifications." As we prepared David for emergency surgery, he continued to demonstrate impossible awareness of medical procedures and hospital operations throughout the facility. "Dr. Rodriguez is going to have complications with the appendectomy in operating room 3, David mentioned casually as we prepared his chest tube insertion. "The patient has adhesions from previous surgery that weren't mentioned in the history. She's going to need to convert to an open procedure." I contacted the OR to verify David's claim. Dr. Rodriguez was indeed performing an appendectomy in operating room 3, and according to the surgical nurse, they were experiencing unexpected complications due to adhesions requiring conversion from laparoscopic to open surgery. "The patient in room 15 is going to code in about 20 minutes, David continued. "His potassium level is dangerously low, but the lab results haven't been reviewed yet. If someone checks on him now, they can prevent the cardiac arrest." Without hesitation, I rushed to room 15, where I found an elderly patient who appeared stable but was complaining of weakness. I immediately ordered stat electrolytes and discovered his potassium level was critically low at 2.1. We began emergency potassium replacement, and the patient's condition stabilized without the cardiac event David had predicted. Dr. Torres joined me outside room 15, his face pale with confusion. "Sarah, David just told me that the helicopter bringing in the motor vehicle accident victim is going to have mechanical problems and will need to divert to City General. He said the patient has a tension pneumothorax that the flight crew hasn't recognized yet." Before I could respond, our radio operator announced that the incoming helicopter had indeed experienced mechanical issues and was diverting to City General Hospital. The flight crew reported that their patient had developed sudden respiratory distress consistent with a tension pneumothorax during transport. We returned to David's room, where he was calmly awaiting transport to surgery. His vital signs remained stable, but his awareness of events throughout the hospital continued to expand in ways that challenged everything we understood about consciousness, and medical science. "I know this is disturbing for all of you," David said, looking directly at Dr. Torres and me. "It's disturbing for me too. I can see things happening not just in this hospital, but in places I've never been. I can understand medical conditions and treatments that I've never studied. It's like my consciousness has expanded beyond the normal boundaries of individual awareness." Dr. Torres sat down beside David's bed, abandoning his usual professional distance. "David, what you're describing is medically impossible. Human consciousness is generated by brain activity, and your brain has sustained trauma that should be impairing your cognitive function, not enhancing it. I understand why this doesn't make sense from a medical perspective," David replied. "But I'm experiencing something that suggests consciousness might not be entirely dependent on individual brain function. It's as if the trauma somehow connected me to information and awareness that exists independently of my physical brain." As David was transported to surgery, I found myself questioning fundamental assumptions about the nature of human consciousness and the relationship between mind and body. If David's experience was real, it suggested possibilities about human awareness that medical science had never considered. Over the following hours, David's predictions about other patients and hospital operations proved accurate, with disturbing consistency. He had somehow gained access to information about medical conditions, treatment protocols, and even administrative decisions that were being made throughout the facility. Dr. Torres and I documented everything carefully, but we both knew that David's case would be impossible to explain using conventional medical understanding. The trauma team successfully repaired his injuries, but his expanded consciousness remained unchanged throughout the surgical procedure. When David emerged from anesthesia, his first words to the recovery room nurse were accurate predictions about 3 other patients who were experiencing complications in different parts of the hospital. Each prediction proved correct, and each intervention based on his information resulted in improved patient outcomes. The implications of David's case extended far beyond a single unusual patient experience. If consciousness could indeed exist independently of individual brain function, accessing information that transcended normal sensory limitations, it would fundamentally alter our understanding of human awareness and medical practice. As word of David's unusual condition spread through the hospital, other staff members began seeking me out with questions and concerns that I wasn't equipped to answer. Dr. Patricia Kim from the neurology department arrived to conduct her own assessment, bringing with her years of experience studying brain function and consciousness disorders. "Sarah, I've reviewed David's case files and imaging results," Dr. Kim said as we stood outside the recovery room. "From a neurological standpoint, his subdural hematoma is minor and shouldn't be causing any enhancement of cognitive function. If anything, he should be experiencing headaches, confusion, and possible memory deficits." I watched through the recovery room window as David continued to provide accurate information about patients and medical situations throughout the hospital. His predictions had become so reliable that several nurses were discreetly consulting with him about their patients, despite the obvious ethical and medical concerns this raised. "Dr. Kim, I've been documenting his statements and verifying their accuracy for the past 6 hours," I explained. "He's made 43 specific predictions about patient conditions, treatment outcomes, and hospital operations. 41 have proven completely accurate, and 2 are still pending verification." Dr. Kim entered the recovery room to conduct her own neurological examination. David submitted to her tests with patient cooperation, answering her questions while simultaneously providing commentary about other patients throughout the facility. "Dr. Kim, the stroke patient in the ICU is going to have another cerebrovascular event within the next hour," David said calmly as she tested his reflexes. "The clot-busting medication didn't fully dissolve the blockage, and there's still compromised blood flow to the left temporal region. If they perform another angiogram now, they can identify the remaining obstruction and prevent the second stroke. Dr. Kim paused her examination and contacted the ICU to relay David's prediction. The stroke team immediately ordered emergency imaging and discovered exactly what David had described. They were able to perform an emergency procedure that prevented the predicted second stroke. "David, I need to understand what you're experiencing," Dr. Kim said, sitting down beside his bed. "Can you describe how you're accessing this information?" "It's difficult to put into words," David replied thoughtfully. "It's as if my consciousness has expanded beyond the normal boundaries of individual awareness. I can perceive information about medical conditions, understand complex physiological processes, and observe events happening throughout the hospital simultaneously. The information doesn't come through my normal senses, but rather through some form of direct knowing that I can't explain." Dr. Kim conducted the most comprehensive neurological evaluation I had ever witnessed, testing every aspect of David's cognitive function, memory, and sensory processing. Despite his traumatic brain injury, David's neurological examination was not just normal, but showed enhanced performance in areas of pattern recognition, analytical reasoning, and information processing. "This is unprecedented," Dr. Kim confided to Dr. Torres and me after completing her assessment. "David's neurological function should be impaired by his injury, but instead he's demonstrating cognitive abilities that exceed normal human parameters. His brain scans show the expected trauma-related changes, but his consciousness appears to be operating independently of those physical limitations." As the night progressed, David's awareness continued to expand in ways that challenged our understanding of human consciousness. He began providing information about patients in other hospitals across the city, describing medical emergencies that were occurring miles away from Sacred Heart. "There's a cardiac arrest happening at Metropolitan General right now," David announced during one of our check-ins. A 42-year-old woman collapsed in their emergency department. The team is having difficulty establishing an airway because of anatomical abnormalities they haven't recognized. If they use a smaller endotracheal tube and approach from a different angle, they'll be successful. I contacted Metropolitan General to verify David's claim. Their charge nurse confirmed that they were indeed managing a difficult cardiac arrest involving a middle-aged woman with challenging airway anatomy. When I relayed David's suggestions, their team successfully established the airway using the technique he had recommended. The ethical implications of David's condition became increasingly complex as the night wore on. His predictions were saving lives and improving patient outcomes, but the mechanism by which he was accessing this information remained completely unexplained by medical science. "Dr. Torres, we need to consider the broader implications of what we're witnessing," I said during a brief break from patient care. "If David can truly perceive medical information about patients throughout the region, we have a responsibility to use that information to help people, but we also need to understand how this is possible." Dr. Torres had been documenting every aspect of David's case with meticulous detail. "Sarah, I've been practicing emergency medicine for 15 years, and I've never encountered anything that challenges our understanding of human consciousness to this degree. David's awareness appears to transcend physical limitations in ways that could revolutionize how we approach medical care." As dawn approached, David's condition remained stable, but his expanded consciousness showed no signs of diminishing. He continued to provide accurate information about medical situations throughout the region, and his predictions had resulted in improved outcomes for dozens of patients across multiple healthcare facilities. "I understand that what I'm experiencing is disturbing and difficult to accept," David said as we prepared for shift change. "But I think this might represent something important about human consciousness that medical science hasn't recognized yet. Perhaps consciousness isn't entirely generated by individual brains, but involves access to information fields that exist independently of physical neural structures. Dr. Kim had remained at the hospital throughout the night, studying David's case and consulting with colleagues at major medical centers across the country. Her research revealed scattered reports of similar phenomena following traumatic brain injuries, but none as comprehensive or well-documented as David's experience. Sarah, I found references to enhanced awareness following brain trauma in medical literature dating back over a century, Dr. Kim explained as we reviewed her findings. Most cases were dismissed as hallucinations or psychological responses to trauma, but the patterns are remarkably consistent with what David is experiencing. The morning shift arrived to find our emergency department buzzing with discussions about David's unprecedented case. Word had spread throughout the medical community, and specialists from neurology, psychology, and consciousness research were requesting consultations. David's story had transformed from a routine trauma case into something that would challenge fundamental assumptions about human consciousness and the nature of awareness itself. His ability to perceive medical information beyond normal sensory limitations suggested possibilities that could revolutionize our understanding of how consciousness operates. As I prepared to end my shift, I realized that this night had changed not just David's life, but my entire perspective on what it means to be human. The boundaries between individual consciousness and collective awareness had been shattered by David's experience, revealing possibilities that medical science was only beginning to explore. The trauma that should have impaired David's consciousness had instead expanded it in ways that defied every principle of neuroscience and medical understanding. His case would become the subject of extensive research and debate, but for those of us who witnessed his remarkable awareness firsthand, it represented proof that human consciousness might be far more complex and interconnected than we had ever imagined. David's predictions continued to prove accurate throughout the following days, and his expanded awareness showed no signs of diminishing as his physical injuries healed. He had become a living example of consciousness operating beyond the normal boundaries of individual brain function, accessing information and understanding that challenged everything we thought we knew about the nature of human awareness. The implications of David's case extended far beyond a single patient experience, suggesting that consciousness might involve access to information fields that transcend individual neural networks and physical limitations. The Medical Ethics Committee convened an emergency meeting the following morning to address the unprecedented situation David's case presented. Dr. Patricia Williams, the hospital's chief of staff, had never encountered anything that challenged standard medical protocols to this degree. David's expanded consciousness raised questions that went far beyond typical patient care considerations. We have a patient who demonstrates impossible awareness of medical conditions throughout our facility and beyond, Dr. Williams explained to the committee. His predictions have resulted in life-saving interventions for dozens of patients, but we have no scientific framework for understanding how this is occurring. The committee struggled with fundamental questions about patient consent, medical privacy, and the ethical use of information obtained through unexplained means. If David could perceive confidential medical details about other patients, traditional concepts of healthcare privacy became meaningless. Yet his information was saving lives in ways that conventional medicine couldn't achieve. Dr. Michael Chen, the hospital's bioethics specialist, raised concerns that had kept him awake throughout the night. We're dealing with a situation that challenges the very foundation of medical practice. David is accessing patient information without consent, yet that information is being used to provide better care. How do we balance patient privacy rights against the potential to save lives? Meanwhile, David's physical recovery progressed normally despite his continued expanded awareness. His subdural hematoma was healing as expected. His pneumothorax had resolved after chest tube placement, and his liver laceration showed no signs of ongoing bleeding. From a purely medical standpoint, his trauma injuries were responding exactly as predicted by established treatment protocols. But his consciousness remained fundamentally altered in ways that defied every principle of neuroscience. David continued to demonstrate detailed knowledge of medical conditions, treatment procedures, and anatomical relationships that should have been impossible for someone without extensive medical education. The strangest aspect of this entire experience, David told Dr. Torres during his morning evaluation, is that I understand I shouldn't be able to know these things. Part of my mind recognizes that what I'm experiencing violates everything we understand about human consciousness. Yet I can't deny the reality of what I'm perceiving. Dr. Torres had spent the early morning hours reviewing medical literature, searching for any precedent that might explain David's condition. His research revealed scattered case reports dating back over a century, describing similar phenomena following severe trauma, but most had been dismissed as psychological reactions or hallucinations. David, I've found references to enhanced awareness following brain injuries in historical medical texts, Dr. Torres explained. But your case is the most thoroughly documented and medically verified example I've encountered. Your predictions aren't vague impressions or lucky guesses. They're precise medical diagnoses with specific anatomical details. The neurology team conducted additional imaging studies, hoping to identify some previously undetected brain change that might explain David's enhanced consciousness. Advanced MRI sequences, specialized brain function scans, and comprehensive neurological testing revealed nothing beyond the expected trauma-related findings. From every measurable parameter, David's brain function should be impaired by his injuries, Dr. Kim reported to the medical team. Instead, we're seeing cognitive enhancement that exceeds normal human capabilities. His pattern recognition, analytical reasoning, and information processing abilities are operating at levels that shouldn't be physiologically possible. Word of David's case had begun spreading beyond Sacred Heart Medical Center. Researchers from major universities, consciousness studies institutes, and neuroscience centers were requesting access to David's case files and the opportunity to conduct their own evaluations. The implications of his experience extended far beyond emergency medicine into fundamental questions about the nature of human awareness. Dr. Rebecca Martinez from the Institute for Consciousness Research arrived that afternoon, bringing with her decades of experience studying unusual neurological phenomena and altered states of awareness. She had investigated hundreds of cases involving enhanced consciousness, but none as comprehensively documented as David's situation. Mr. Mitchell, I'd like to understand more about how you experience this expanded awareness, Dr. Martinez said as she began her evaluation. Can you describe the mechanism by which you access information about other patients and medical situations? David considered her question carefully before responding. It's not like receiving information through normal senses. There's no visual or auditory component to what I'm experiencing. Instead, it's more like direct knowing, as if the information about medical conditions and treatment needs simply becomes available to my consciousness without any intermediary process. Dr. Martinez conducted specialized tests designed to measure various aspects of consciousness and awareness. Her evaluation included assessments of extrasensory perception, remote viewing capabilities, and other phenomena that existed at the boundaries of conventional scientific understanding. David, I'm going to show you photographs of patients in other hospitals and see if you can provide any information about their medical conditions, Dr. Martinez explained. This will help us determine whether your awareness is limited to Sacred Heart or extends to other healthcare facilities. David studied the photographs with obvious concentration, and within minutes he began providing detailed medical assessments of patients he had never seen before, in hospitals hundreds of miles away. His descriptions included specific diagnoses, treatment recommendations, and prognoses that proved accurate when verified through follow-up communications with the distant medical facilities. The patient in the first photograph has developed sepsis from an unrecognized post-surgical infection, David reported. The wound appears to be healing normally on the surface, but there's deep tissue involvement that hasn't been detected yet. Her white blood cell count is elevated, and she's going to develop fever and hypotension within the next few hours if antibiotics aren't started immediately. Dr. Martinez contacted the hospital where the photographed patient was receiving care. The medical team confirmed that the patient had indeed developed signs of sepsis that morning, exactly as David had described. Emergency antibiotic treatment was initiated, and the patient's condition stabilized without the predicted deterioration. The accuracy of David's remote medical assessments was unprecedented in Dr. Martinez's experience with consciousness research. David, you've just demonstrated medical awareness that transcends physical proximity and normal sensory limitations. This suggests that consciousness might involve access to information fields that exist independently of individual brain function. As David's case gained attention throughout the medical community, researchers began proposing theories that challenged fundamental assumptions about human consciousness. Some suggested that trauma might temporarily alter brain chemistry in ways that enhanced access to collective information fields. Others proposed that consciousness might exist partially outside individual neural networks, accessing shared knowledge through quantum mechanical processes. Dr. Sarah Kim, a quantum physicist who specialized in consciousness studies, arrived to investigate whether David's experience might involve quantum entanglement between his consciousness and information systems throughout the healthcare network. Her theoretical framework suggested that under certain circumstances, individual awareness might become entangled with broader information fields. Traditional neuroscience assumes that consciousness is entirely generated by individual brain activity, Dr. Kim explained to the assembled medical team. But quantum mechanics suggests possibilities for information sharing and awareness that transcend physical limitations. David's experience might represent evidence of consciousness operating through quantum entanglement with medical information systems. The testing continued throughout the following days as David's expanded awareness remained consistent and reliable. He provided accurate medical assessments for patients across the region, predicted treatment outcomes with remarkable precision, and demonstrated understanding of complex physiological processes that exceeded the knowledge of many medical specialists. "I've been thinking about the implications of what's happening to me," David told the research team during one of their sessions. If consciousness can truly access information independently of individual brain function, it suggests that human awareness might be far more interconnected than we've ever realized. Perhaps individual consciousness is just one aspect of a larger collective awareness system. The philosophical implications of David's experience were as profound as the medical ones. If consciousness could indeed transcend individual neural boundaries, accessing shared information fields, it would revolutionize understanding not just of human awareness, but of the fundamental nature of reality itself. That night at Sacred Heart changed everything I thought I understood about consciousness, medicine, and the very nature of human awareness. David's case became the subject of international research, challenging every assumption we held about the boundaries of individual consciousness. His expanded awareness never fully returned to normal, and he eventually established a foundation dedicated to exploring the connections between trauma, consciousness, and healing. As for me, I couldn't continue working in emergency medicine after witnessing something that shattered my understanding of what we consider medically possible. I transferred to research nursing, dedicating my career to studying cases like David's and exploring the mysteries of human consciousness that conventional medicine has yet to acknowledge. That terrifying night taught me that there are aspects of human experience that textbooks can't explain. And sometimes the most profound discoveries come from embracing the impossible rather than dismissing it.